Welcome to Inside Exchange, Topics for Manufacturers, a series bringing you expert-led presentations on the issues that matter most to members. The curated topics in this series feature presentations from associate members and subject matter experts through on-demand and live webinars to help Hudson Valley manufacturers. If you have topics you'd like us to explore in future episodes, contact us at info@councilofindustry.org. Let's begin.
Welcome to Inside Exchange, Topics for Manufacturers, a series designed to bring Council of Industry members timely, practical insights from subject matter experts on issues shaping manufacturing today. In this episode, we're focusing on healthcare cost escalation and policy uncertainty, an issue that is already creating disruption for employers and is expected to intensify over the year ahead. Today we're joined by Luke Strothenke from Mid-Hudson VIP, who will walk us through what manufacturers should be paying attention to as Medicaid changes, plans increase, and market pressures affect employers of different sizes and structures differently. This is a great conversation. Let's get started. Luke.
Yeah.
Thank you so much for doing this. I'm really happy that you were able to hop on and record this with us today. You know that this is top of mind for a lot of our members. There is so much disruption already this year and to come, but adding into this the healthcare costs and uncertainty really feels like it's timely. So I first want to say thank you for agreeing to talk with us today.
I'm very happy to be here, Johnny Ann, and thank you for having me. Yeah, I mean, with the upcoming cuts to Medicaid and with the Hudson Valley small group, health plans taking a 22% increase this year, there's kind of a lot of moving parts, and I'm happy to talk about kind of why different business sizes and manufacturer sizes are going to be impacted in different ways. I think smaller business is going to be, kind of as always, facing the brunt of this impact. And larger companies could actually, see an influx in talent. But unfortunately, I think that it's going to be coming from smaller companies. Right. Right.
I appreciate that. And I appreciate that today we're going to kind of go over that, just like depending on the size, how this is not literally not one size fits all. I think you had actually said that. So why don't we start with this? Tell us a little bit about yourself, about your company, history, all the fun things.
Sure. My name is Luke Strothenke. I'm an insurance broker. I'm a consultant for businesses and I set up employee benefits plans for them. We work with a number of manufacturing groups already. And basically, what we're doing is kind of front to back employee benefits plans where we're going to pick a plan that's right for your company and for your staff. We're going to figure out your budgeting needs. And then we're going to kind of roll those benefits out to the employees so that they understand them and can use them. And we'll do that in the form of, an employee benefits enrollment platform. But basically, the way that I get paid is by the insurance company, but I act purely as a consultant for my clients to make sure that they're not, paying more than they should be on their medical costs. So we kind of work creatively with HR directors and owners of businesses to make sure that they're able to accomplish their goals.
So this might be off topic, but just big picture. If somebody is thinking about either, making a change or starting to offer something, I mean, some of our companies are tiny enough that this is their first conversation. How soon should they be reaching out? And then also, like, what questions should they be asking? Because to me, as someone who worries about salespeople, I'm always afraid of reaching out because I don't want to get stuck in some situation where just because I sent an email and said, I'm curious about this now, you own me for the rest of my life.
Yeah. And definitely use a broker. It does not have to be me, but the important thing to know about when to reach out if you're trying to start a plan immediately is that for group health insurance plans, you can start a plan at the first of any given month. So if I have an application and enrollment forms submitted prior to the first of any given month, even sometimes after, you can backdate
Yeah.
policies if information's still kind of trickling in. You can do that whenever you need to. We just find that a
Mhm.
lot of businesses kind of schedule their healthcare to renew January 1st. There are also some plans that reset in the new year, regardless of when the rates reset. The plans, the benefits will renew January 1st and deductibles will go back,
Right, to
reset
reset.
in the new year. So any time is a good time to talk about it. We just find for established groups, it's gonna become relevant usually 3 months prior to their renewal, anytime
Yeah.
in that window, in that quarter leading up to their renewal, that's when it's gonna make the most sense to start figuring out what you're doing for the next cycle.
And then I think, I feel like sometimes you want to just be on a plug and play, like it is what it is. I mean, you and I talked about this in my personal life, right? I just really, I don't know, I just want the one I had last year and then I don't want anything to change. But I know as companies, this is not the season for that, right? This is not the season to just kind of hope that what you did in the past works this year because of all these changes and what's kind of coming down.
Yeah, I mean, I think that we're seeing a lot of unfortunately negative changes happening on, the small group side, and it's, fortunately or unfortunately, we have more competition happening in the Hudson Valley
Hmm.
for small group health plans. So like United Healthcare is going to be in contention up here for the first time in my career for groups sizes 1 to 100.
Okay.
And then MVP and CDPHP have kind of been duking it out in the Hudson Valley for that book of business
Mm.
for the last, 20 years. So, so there is more competition. There are more factors to consider. Networks are changing all of the time. Formularies are changing all the time for prescription drugs. So it's not a one size fits all scenario, but I will say that there is something out there for everyone.
So, a lot of our members kind of fall in that sort of sweet spot, the mid-sized companies. They're,
Mhm.
big enough to have some structure. They probably already have some plans in place. They're already hopefully doing all the best things. But we do have a couple of, I think you recently met with a company, very small in manpower, but large in ability, company like that. So let's just kind of walk it through the impact of how this is going to go depending on the size of your business.
Sure. So, I mean, company size is going to be very important for groups from 1 to 25. You're actually eligible for 2 years to get a subsidy if your earnings are at a certain amount or if you're contributing at least 50%. You could go on the shop marketplace and get a small business subsidy that will help cover some of your costs for healthcare. So 1 to 25, that matters to you. You're going to be able to figure that out. And then companies 1 to 50 employees, you're not mandated to cover any certain percentage. You can cover 50% if you want that shop eligibility to get the subsidized coverage for your business, but you're not actually mandated to offer healthcare. And that's the big thing because once you get to 50 and above, then you're going to be forced to comply with ACA standards, and that can be a huge sticker shock to employers as they reach that full-time equivalent number of 50 because they're gonna end up having to pay what is the standard of, it's called affordability, and there's a calculation for it. And I have a slide coming up, but spoiler alert. Um,
I love spoiler alerts.
there's a major increase in what they're, requiring for you to offer for those 50 plus groups. So while we're in a marketplace where you now have to pay 22% more as a small
Mhm.
business, you also are having an increase of what percentage of that 22% increase you have to bear as a company. And it's mandated that you do so. Otherwise, you're facing financial penalties. So you have to be very strategic about when you're going to enter that phase of growth, and
Mhm.
unfortunately, it has to become part of the zeitgeist. And then, for businesses over 100, congrats, you're out of community rating, which means that you're not paying the exact same rates from, that the employers who are 1 to 100 are paying. Now you're going to be rated based on the experience of your group, uh,
Mhm.
based on kind of your demographics and how healthy your company is. But that's a double-edged sword because if your company's not healthy and you don't have favorable demographics, that can really
Right.
hurt you. And until you reach the 250 employee mark, you really don't get a lot of data on what's going on within the company that's causing those claims to go up and spike. And so you know that your healthcare spend is going up, you know that your premiums are going up, but there's not a whole lot that you can do to kind of counteract that when you're in that range because you don't have transparency between you and the health insurance company. So it's complicated.
Yeah. Okay. It's complicated. All right. So let's go a little bit deeper.
We kind of talked about this already, but um, it matters for all of the reasons we just discussed. We can kind of
Yeah.
get through that and start to get into kind of how it's relevant to each size group.
This is interesting. So this is what you were just saying a couple of minutes ago, right? That
Mhm.
there may be some incentives if you're at that smaller side, you can go and you can look for those tax credits and figure that out. But then, okay, not a ton of our companies are fit in that category. And then the next one feels it just gets a little harder every time.
Yeah, well, it's very nuancy. I will say
Yeah.
that. Like if you're a small business, I encourage you to start looking at PEOs, which are essentially payroll companies that found a loophole that allow you to join under their EIN just for filing purposes only under their tax ID. And that gives you the capacity to join their health plan as a large group, but it's a double-edged sword as well because you're going to be rated based on the experience of your very small group. So a lot of PEOs will not even underwrite a group with fewer than 5 employees. So that doesn't really apply too much to these smaller groups. For these smaller groups, usually it's kind of key people that you're offering benefits to, and you're kind of pigeonholed into the community rates, which again is just 1 to 100 cookie cutter rates that you kind of read off a giant menu that they send out. I think that a lot of these employers, unfortunately, may feel the effects of the upcoming Medicaid cuts.
Yeah, I was gonna
Um,
ask about that. Yeah.
yeah, because, you know, if they choose not to offer, which a lot of businesses of this size just simply can't afford to offer coverage to their employees,
Yeah.
it's gonna, if you have employees who came on to kind of help your startup business, they may now be receiving subsidized care that is going to get regulated away. So
Right.
if that ends up being the case, I think it's very possible they could either kind of demand that you offer coverage
Right.
or
Or just look for other opportunities.
right, look for other work, which is tough.
Yeah, I
Uh,
mean, and honestly, on our end, we're constantly trying to fight that battle of just like how to be the employer of choice so that you can get the talent that you want and deserve and it's going to help you, but also retain them. And this is just, another little slice.
yeah, it creates additional competition, but it also really strains small businesses because I'm going to keep
Yeah,
harping on this number. CDPHP's renewal is 22% across all plans, and that's on average.
right.
So they were the lowest cost carrier in our area. So I said before, MVP and United Healthcare are competitive, yes, but they're competitive against that 22% increase. So
Yeah.
they're in the same price range in 2026
Mm.
as CDPHP, and it's really kind of getting tough for small business, basically 1 to 100. So
Okay.
I'm gonna
All
move
right.
move on to the next group just so we can kind of fly through these.
Yeah, yeah, absolutely.
1 to 50, this is when you actually really can start considering PEO as sort of your fastball. There's not a whole lot of other ways to reduce your costs,
Okay.
but you're still not mandated to cover. any amount under the ACA currently. So like 1 to 50, you could offer $0 or you could cover 100% of the premium. That's all right. I'm just going to skip to the recommendations. I would say offering a PEO is a good plan, but PEOs require 50% participation. So it's going to be a kind of niche situation. Sometimes they'll accept waivers if you have close to 50%, but you have someone who's, under the age of 26 who's still getting it through their parents.
Right.
They might waive that person because they wouldn't be taking it even if you covered 100% of it because mom and dad still have them. But
Yeah. Fair.
so
We've had a
some
couple of
accept those
those.
waivers, some don't. Yeah. And then what we tend to recommend within this range too is putting together like a bronze plan that's going to cost you a lot less as a company and funding a portion of the benefits and the deductible as a company as well, so that the employee actually feels like they're getting something up front
Hmm.
for their benefits. So what an HRA is and does is it's essentially a bank account that employers can set up and will allow for the employer to, on a tax-free basis, pay claims for the employees as they come in.
Okay.
So those are very effective as a cost saving measure because now you're not shelling out, 1,500 bucks for a single plan for a
Hmm.
platinum, but an employee still feels like they're getting a platinum level benefit. They go to the doctor, they pay $0 if you're funding, the front portion of that deductible, and that's nice.
Yeah. And
Uh,
then these are the kind of conversations you want to be having to figure this out, right? Like how it kind of in some ways, I hate that, but it is what it is, right? But here's a way that can be in the best interest of your company, both bottom line and also the employee, so that they feel connected, so that you can retain that talent and everyone gets covered. I mean, honestly, healthcare matters. We don't want the opposite to be true either.
Yeah, you want a healthy workforce for sure, and you need to remain competitive to keep your healthy workforce. So
Yeah.
HRAs go a long way in kind of improving employee satisfaction. And
Hmm.
I think that that's kind of the name of the game. If you're just offering a bronze plan and don't fund any of the deductible and the out-of-pocket cost for an employee goes to $8,500 a person,
Yeah.
kind of feels like they don't have health insurance. I think that's what a lot of the frustration around health insurance in general is.
Yeah.
And then beyond that, there's also other mechanisms like HSAs, which would belong to the employee, but that allows for employees and employers can contribute to it as well, but it allows for them to kind of hedge their bets and say, okay, I'm going to take a high deductible plan, but I'm going to fund and put some money aside
Yeah.
in order for those costs to be covered once or if something does come up.
Yeah.
We try
Yeah.
to we try to educate them to participate in those plans where they're eligible.
Yeah, I think some of the frustration we hear are people who have, they provide something, but they feel as if that it's still costing me so much money that they don't feel like that. But also on the flip side, we know this that it's really expensive, even from the employer perspective. It's really expensive. I think we share a mutual connection with somebody who you recently assisted, and we saw them at an event, and they made a joke and said it's really expensive. Just
Yeah,
to
yeah,
just
exactly.
like that, just in general, like, hey guys, healthcare is expensive, and they were happy that you were able to help them find some ways and the best way to do it, but it's still
Yeah,
pretty
and if it's
much.
the person I'm thinking of, they kind of got the best
Yeah,
the best
they
deal money
absolutely
can
said that.
buy.
They absolutely said that they were just kind of like coming into the world of being like, yesterday I didn't have to think about that at all. And
Yeah,
now hearing it. All right, so now we're coming up on that 51
yeah.
cliff.
Now this is where it gets to the point where you have to do it. So there is unfortunately a large increase coming for affordability in 2026. And so basically the way that affordability works and how you calculate it is know any one employee who's eligible for benefits within your company can be paying more than 9.02% of their salary towards benefits. That's a an HMO plan, which means it's only the regional network, and the January rate is $931 for an individual. So that is the baseline. So you then have to establish, okay, we're going to pay whatever percentage makes it so our lowest paid person doesn't have to cover, that amount of their salary. So you use that plan, and if you're in 50 to 100 employees, you will always put this plan in as an offering.
Mm-hmm.
Not you need to, because that's going to reduce the amount that you have to cover if affordability matters to you. If it doesn't, like, and you're covering 100% of all of your employees'
Yeah.
coverage, or your benefit is richer than this, that it
Yeah. Good.
still meets compliance for this calculation at your lowest cost plans, then by all means, you'll be more competitive within the market. But
Yeah.
for everybody else who's worried about this threshold, you should definitely have that plan in place. That's going to be the cheapest plan you can offer this year.
Wow.
And that plan has a $10,150 deductible for context.
Wow.
Family coverage is over 20 grand. So
Mm.
it's brutal,
Wow.
but it's kind of something that you just need to have in place for this compliance purpose alone. Uh,
Right.
and then, yeah, I mean, that is going to increase your complexity because you're going to have to file 5500s for the ACA compliance piece as well. So this is where we see HR kind of taking a much more active role. A lot of companies in the 1 to 50 space, sometimes the owners kind of still doing it themselves and
Yeah.
figuring it out. But at this point, it's kind of important that either you hire an HR manager,
Right.
or you can work with a PEO like we talked about, which might reduce some of these costs in terms of what you can offer. Because if you are offering a PEO plan, then you can drive that, $931 down to a much more manageable rate, and then you're
Right.
paying a lower amount based on percentage than you would be. So
Oh.
that's when I think if you're over 50 and you have at least 50% participating, it's not even a question of should you work
Yeah.
or consider working with a PEO. You should consider it. And the knock against PEOs is when you have healthcare costs that come down. A lot of
Yeah.
the times, magically, you'll see HR costs go up within the
Okay.
PEO because they kind of know they've got you.
Yeah.
But we negotiate that as well. They're partners of ours. They want us to continue to advocate for using PEOs. So
Yeah.
they kind of try to stay in our good graces by, when we say like, hey, this is my client, like don't be
Right.
charging them
Right.
the
Yeah. I
maximum.
mean, at least out the gate, they want to win the business.
Exactly.
Whether or not they have that same mentality year over year will is kind of to be determined. But I think, we also feel like our partners are pretty good and fair. And
Yeah.
there's no cheap way to do the business, even on their end. Right? I mean, there's a lot to it.
Yeah, that's the rub too, is like in year two, you will see costs kind of spike. They'll throw you a, hey, come get in the door discount. And then if you're
Yeah.
not paying attention, you could see
Yeah.
some jumps there. And that, so if you're on a PEO right now, keep an eye on your admin
Right.
and
Right.
just make sure that they're not increasing that admin on you. You might see like, oh, we only got a 5% increase in our health insurance renewal. That's great compared to the 22 that Luke's talking about with Johnny Ann.
Yeah.
But uh,
But
yeah,
right.
but if they jump you up 22% on the admin,
Yeah,
it's
you might want to ask some questions.
exactly.
And do some follow-ups. I don't know if this is a good place to talk about this, but I know you and I recently had a conversation a little bit about options of people to try and self-insure, try and, figure out other things. I know that that's not what we're talking about today, but, if anyone's listening at this point and says what they kind of feel like, what if I just figure this out on my own?
Yeah, yeah. I mean, if anyone's still listening because they haven't zoned out on insurance speak at this point. But I would say still work with a broker no matter what you're doing. Doesn't have to be me. Just has to
Sure.
be somebody to make sure that you're getting the best in terms of cost. And then in terms of self-funding healthcare, that we can actually talk about on the next slide here, because companies larger than 100 employees, I keep doing
Got it. Well, see, look at me just teeing you up for that. Not even knowing that that was your next slide. Keep going,
Yeah,
sorry.
yeah. So companies over 100 employees in New York can begin to look at self-funding. We are kind of advocating for group captives
Mm-hmm.
within this space because particularly Pareto, because they're the largest group captive in the country. But when you get over 100 employees, you're like, all right, I can see daylight. I'm out
Mm-hmm.
of this
Yeah.
mandated small group
Purgatory.
market, right?
Head count
Purgatory.
purgatory. I think
And
that's
then you get there, and it turns out that you don't actually get to see that data, which is something we spoke about before. So, like, you can't see what claims are impacting your group. But if you join a captive or you take a level funded product,
hmm
they will give you the transparency into your claims to see, okay, what's really going on with us. The big thing that everyone is talking about right now is GLP-1 medications for weight loss and for
Yeah.
diabetes. They've been very successful for losing weight, and they're popular for a
Yeah.
multitude of reasons right now, but they are kind of being viewed as a statin where you start on it and you don't ever come off of it. And they're very expensive. So if there's a big, you know, prescription drug cost and component to your business, the captive can see that and they'll kind of educate you on programs that you can put in place where they can roll discounts out to members who are using those drugs, who are influencing your claims, that the company at that point is self-funding and paying out those claims.
I
So
see.
they can find ways to reduce those costs for your employee, but also for your business who's funding the claims as they come in. And if there's a high concentration in cancer in your company, they can do the same thing. So that's why we've kind of been making group captives our fastball within this range because you may still get favorable rates at this company size in the fully insured market, but you won't know why you're getting them, and that's the trouble. So
Yeah. And if, I mean, if you're if you're at the point to want to investigate and see all your options, you should just want to see all your options. And at some point in time, I think data is kind of worth it, right? Like just to know what you're getting. That also helps you know, not that the world is that predictable, but what's to come next in your next, slice of the wound. And
yeah,
what's coming up as a result of being able to see why your rates are what they are.
exactly. And captives see better results because there's a vested interest from the other captive members who
hmm
are participating. So, the way that a captive works, for those who don't know, is you get scale by pooling with a bunch of companies who are self-funding their insurance. They're all paying the claims as they come in. They lease a network from an insurance company that the employees get to utilize, but the claims get paid by the company. But the way that a captive comes in is, okay, if my company has a terrible year, and we've paid exorbitant numbers of claims. But another company within the captive had a really, really good year and they saved a ton of money. Those costs will kind of stabilize together and the increase will be, lower for the company here that had really low claims, but it will also reduce the amount of impact that that has year over year. So in terms of volatility, if you went fully self-funded where you're just paying the claims yourself and hoping for the best, you may have years that are way up and way down versus within the captive, you'll kind of have more of a linear curve that stays a little bit more stable. It decreases that volatility. So we're a big proponent of that. And I think there's just kind of a lot of cost that happens to keep the lights on at insurance companies.
Yeah.
And and so, you know, you're funding their benefits that they're offering to their employees as well
Yeah.
when you just stick with the fully insured plan versus you can kind of cut them out of the equation a little bit by saying, hey, we're going to take your network, we're going to use it, we'll pay you a little bit for that, but then we're going to take a stop loss policy and we're going to put that in place so that we can't get, too crushed if we have a bad year medically. But by and large, we're just going to try to pay for this ourselves and see how it goes. So
Yeah.
self-funding is more and more prevalent these days because the fully insured market has just trended up and up and up and up. And so people are desperate for a new solution.
Yeah. Okay. Good options. Okay. So I think you were also going to say something about these requirements at this level where there's a little bit more breathing room, or
Uh,
maybe we did kind of cover that, right?
we did kind of cover it. I would say, level funding will also give you some transparency, but within fully insured, you're really not going to get that data until you're at 250.
Okay.
So 250 plus. This is where the world is kind of your oyster, where if you're running really well, then go self-funded. I think most companies at this size should at least be having the conversation, and they should be having it year over year because you will have data and you will know where your claims are coming in. So at this point, you can see how high utilization is. You can see how many of the employees, how many went over the pooling limit, which is just like the amount of cost they were supposed to generate. So like if they have claims over 150,000, for example, you'll know how many folks fell into that category and how that's going to impact your rate increase. But if that's a small, piece of your demographics, you'll still be okay.
Yeah.
So it becomes, every option is available to you at this size. You can
Yeah.
do a level funded
And
product.
chances are, if you have that many employees, you also have the administrative staff to be managing and finding out that, doing the research, checking out with, talking to different companies and consultants and reviewing your data, or at least you'd like to think that that's how it works.
Yeah, yeah. I mean, you do see there can be a paralysis by analysis that happens within these
Sure.
companies too,
Yeah.
where an HR manager is like, okay, I've seen 1,000
Yeah.
different ways that we can chop this up that it's like
Yeah.
I can't even consider another broker coming in
Yeah.
and trying to mix it up. So we get that too. There's a lot of competition among people like me for these groups. But there are different solutions that if you've been in the same kind of strategy for a number of years and you see the rates continue to increase, I would say every couple of years it does make sense to kind of go to market and put out a formal, RFP and see if
Yeah.
somebody's got a better idea. This is the first time I'm bringing this up, but this does apply across all different sizes of companies. Wellness plans are more and more popular within any form of healthcare and health coverage. The insurance companies want you to put a wellness plan in place because if you have people who are on top of their fitness and wellness, they're much less likely to get sick. So
Yeah.
it's self-interested to a
Right.
point where where they want you to be healthy, but just because it advantages them doesn't mean it also doesn't, come at an advantage to the employer and to the employee. So definitely take advantage of whatever incentives are being offered to you. They're offered at basically every size company that we've discussed today. So
Geesh, how do you wrap your head around it?
you just do it 10 years every day.
And
But
then, I
yeah,
mean, yeah, go on.
no, it's constantly changing. It is a gigantic puzzle, and it's unfortunately something that employers really don't have a choice but to deal with. So,
Yeah. You mentioned a little bit about the Medicaid cuts and how you see that possibly rippling out, right? I think you said that there might be people who are in those smaller brackets that you're not paying for their insurance because they're getting it through this other source, and now they're going to need to either. Do you want to talk a little bit just
yeah, yeah. So
how
since
that
the Affordable Care Act
triples?
came out, you do have a class of employees that are saying, or employers that are saying, hey, I'll just send my people to the exchange. It's less money for them to do that, and it's less money for me to pay them.
Yeah,
And so they'll go get free healthcare. I can keep my costs down, and that has worked for everybody for a while. For groups over 50, that doesn't really apply to you because you've had to, offer benefits. But there will be people within those populations who've said, you know what, I'm getting, more affordable coverage elsewhere. So I'm just going to continue to do that. And I think that's where we're going to see a big impact is employees are going to start to demand it at the smaller business level. And if it's not something that a small employer can come up with, I think it's going to cause a bit of a shakeup in the job market because at this scale that you're seeing on your screen at 250 plus employees, your costs are way lower per participant in
Yeah.
the health plan. And
Yeah.
so it's less impact for you to pick up a highly talented person that was basically running a full startup
Yeah.
and bring them onto your team. You can pay them, you have the scale to pay them more and you have
Yeah.
the scale to provide better benefits to them. So that's my concern. That's why we're kind of really advocating for the PEO route. I mean, I know I'm kicking a dead horse on that, but
It's okay. This is the window of time to do it.
yeah, I think that the vehicles that allow you to pool your risk with other companies like self-funding through a captive, or
Yeah.
I know you guys had a conversation recently about joining a consortium
Yeah.
or joining with a PEO, or we work with a trust that allows for groups to jump into a self-funded plan through a union. Like
Yeah.
there's those are the vehicles that are proving to cost less and provide the same standard of care. So we're big advocates of that. I think that that's where everything is kind of trending. And unless we see major changes within how small group is run,
Yeah.
I know there's some advocacy to reduce the community rating number down to 50, which it is in other states like Jersey. That could be beneficial long term, but
Yeah.
for now, I don't see the trend slowing down.
Yeah. Doesn't seem like anyone's trying to make it easier to do business
Yeah,
around here. At least
exactly.
not right now. Any final words, anything about where we can reach you or just, final tips as to how
Uh,
someone can approach this?
Final tips, I would say just use a broker. A broker, if you're in any fully insured product, there's no additional cost for you to use someone like myself to kind of give you the lay of the land on this stuff. And most people already are who are offering coverage, but you could vet them, check out other sources. If you're not hearing about PEO from your broker because they don't have relationships with PEOs, you should kind of either suss that out yourself or you can talk to a broker like myself about how to put those into place.
Yeah,
Um, but yeah, I would say just try to get creative. There are, a lot of ways to skin the cat here, and you're not without options.
that's great. And you're comfortable with me sharing your information as well?
Of course, yeah, it's on every slide. I was very
Yeah,
comfortable.
no, that's great. And look, honestly, I just also want to say thank you because you've always been a great resource for me and for the people that I'm just kind of hearing and thinking, can I run this by you and see how that goes? You've always been a good friend of the association and we appreciate it. So thank you for taking the time and for sharing your knowledge.
Thanks, Johnny. I really appreciate you as well.
Thank you for watching Inside Exchange, Topics for Manufacturers. We hope you found today's episode valuable. To learn more about the Council of Industry and explore additional resources, visit us at councilofindustry.org.